I want to start, if I can, Cathaoirleach, in offering my condolences to the family of Tom Burke, his wife and his children. He was an ever-present character in the best possible sense around Leinster House, and he will be missed by his family, but also people in Leinster House as well. Taoiseach, this morning there were 451 people on trolleys in hospital corridors and squeezed into free space. Limerick, Galway and Cork are still the worst hit hospitals, as they have been for years, with no change. Waiting lists are spiralling out of control, with more than 900,000 people on acute lists and 200,000 people more on diagnostic lists. This includes more than 100,000 children. The mind boggles, Taoiseach, when you reflect on that volume of people who are on waiting lists and for the length of time that they are waiting. We are back to high trolley counts, with waiting lists out of control, and this government, it seems, has no plan to deal with it. And there are real human consequences from this crisis. Over the summer, Taoiseach, I conducted a survey on the impact of long waiting times on patients, and the results were stark. Long waiting times have severe consequences for stress and anxiety, with a major negative impact on their quality of life. And found that 75% of people's conditions have gotten worse because of their wait, and this is particularly severe for those waiting more than a year. It is clear that care delayed is care denied, and long wait times fail patients. And there are severe consequences for their mental health, with more than 70% reporting that their mental health has been severely or considerably affected. Taoiseach, we need to see a waiting list plan from this government. It cannot be more window dressing, it cannot be more committees, it cannot be more talk. It has to be about action, capacity and resources. And you know, Taoiseach, that we need more beds, more staff and more capacity in diagnostic and surgical theatre space. I know this from my own experience in Waterford, and I'm sure you know this from your own experience as a previous Minister for Health. We also need modern IT systems. One area severely affected by capacity has been maternity services. Taoiseach, we need to see real investments in maternity services to ensure women in this country have the highest quality of care. You may have noticed the protest outside Leinster House yesterday, where pregnant women and their families with young babies had no choice but to travel to Dublin for a protest to end maternity restrictions. Partners have been locked out of appointments and labour because of a lack of space and outdated buildings, and of course because of infection control measures as well. Yesterday, many government backbenchers stood in solidarity with and gave commitments to the women affected and expectant mothers. I want to take the opportunity this morning to commend Linda Kelly and the Better Maternity Care campaign, who organised that protest, and the others who spoke or travelled. We have all, Taoiseach, heard the tragic and horrific stories from women abandoned in the most heartbreaking situations. Taoiseach, these maternity restrictions need to be lifted now, and you and your government need to act on this. All parties and none who stood in solidarity now have to make sure that there is action. So, Taoiseach, can I ask you, what is your government's plan to tackle waiting lists? What is your plan to inject capacity into our healthcare system? What is your plan to ensure that we don't, as I heard in Cork on Monday when I met with the CEO of Cork University Hospital, that we are facing into an horrendous winter in acute hospitals of more overcrowding, more people on trolleys and waiting times get longer? What specific injections of capacity and resources are going to be put into our healthcare system, and also what will you do to end maternity restrictions?
Thank you. Thank you, Deputy.
Thanks, Deputy. There's a lot of questions there, and all very valid questions, and I'll do my best to answer them as best I can in the time allowed. But first of all, I just want to join with the last Cathaoirleach in paying my respects to Tom Burke, who is a truly fine man, one of the first people I met and got to know when I became a member of this House, was a feature of Irish politics and Irish photojournalism, and I was really sorry to hear yesterday that he passed away. I want to extend to his family and friends the government's condolences and that of my party as well. At the outset, I just want to acknowledge the enormous distress and enormous distress and discomfort that overcrowded emergency hospitals cause patients and their families, and also frontline staff working in very challenging conditions in hospitals throughout the country, and also the risks involved in terms of infection control and delayed care. The HSE reports that there were 292 patients on trolleys this morning in our hospitals. That's up from 164 this day last year, when hospitals were largely closed due to the pandemic, but substantially down on previous years like 2019, where it was 451 a day around this time of year. 292 is still 292 too many, however, and it's not acceptable that people should spend prolonged periods of time on hospital trolleys awaiting admission. What's our plan to deal with it? Increasing our bed capacity, increasing staffing levels, modernising care pathways, and expanding care in the community. So just since this government was formed, really since the pandemic started, we've added more than 800 beds to our acute hospital system. And that's why the number of people in trolleys, while still too high, is substantially lower than it was in 2019, before we added those additional beds to the system. And we need to add more, and we have detailed plans to do exactly that, spelt out in the National Development Plan only earlier this week. We've also increased the number of staff considerably. The HSE has recruited between 7,000 and 8,000 additional staff so far this year, have authority to recruit more, and that authority will carry over through to next year. But we'll all understand the difficulties that exist, both in Ireland and around the world, in recruiting healthcare staff. But having added 7,000 or 8,000 staff alone this year is a significant increase, and it is making a difference. We're also expanding care in the community, enabling more people to receive their healthcare in the community so they don't have to go to the hospital in the first place. And that's largely done through building up our GP services, and that's being done particularly giving GPs greater access to diagnostics. And we've also put huge resources into home care. The waiting times for home care are substantially down on where they were before, and that means more patients can get out of hospital quicker, and that frees up beds too. And the same thing goes with the adequate funding of the Fair Deal. So they're the main things that we're doing at the moment. This, of course, is all done against a backdrop of a rising population, an ageing population, and huge pent-up demand for healthcare as a consequence of healthcare deferred during the pandemic. So it's a difficult situation, but the government is very much acting on this regard. When it comes to waiting lists, you'll know that a task force is now being established in the Department of Health to get waiting lists down. The reason for the high waiting list at the moment, they were high before the pandemic, they're even higher now. That's because of the care that was deferred as a consequence of hospitals being closed or partially closed for the duration of the pandemic. And that has built up a huge unmet need. And the process and the way it's going to be managed is similar to the vaccine task force, which was so successful in producing our vaccine programme, and we want to take the same approach now to reducing waiting lists.
Thank you, Tánaiste. Of course, you're right to accept that there is enormous distress caused by high wait times. And you talked about the risks involved for patients, and yes, there are risks for staff as well, as we know. You know, as a former Minister for Health, that essentially healthcare is about people treating people. And it's about making sure that the people who work in our health services are valued, but also that they have the resources. So when you talk about what you did last year, Minister, I think you have to be a bit more straight about, on the one hand, what was promised and what was delivered. So there was 1,150 additional acute beds that were funded and committed to in last year's budget. It was confirmed yesterday by the Secretary-General of the Department of Health. About 150 of those will not be delivered. He talked about the 7,500 staff that came into the healthcare system, and I celebrate that. We need it. The promise was 14,500. 14,500. And we'll have managed 7,500. And when you talk about community services, 150 million was provided last year for enhanced community services. You might not know this, but half of that money will not be spent to deliver the community intervention teams that were promised. So when people hear about task forces, they will judge the government on their record, what they committed to do, what they promised to do, and what they have done. And in your response, you might also respond to the issue of the maternity restrictions as well, Tánaiste. Thank you.
Thanks, Deputy. The budget for the health service this year is €22 billion. It's the biggest health budget we've ever seen in this history of the state. When I was Health Minister, it was 14. It's 50% higher than it was then. More than double what it was when I was practicing as a doctor in the public health service. So money is certainly not the issue anymore when it comes to our health service. And you point out yourself, some of the money will even go unspent this year. So there's no lack of money and no lack of political will. But there are real constraints. It's Adding an additional hospital bed, as you know as well as I do, isn't simply buying a piece of furniture. It's a whole system, and that takes time to do. And recruiting people as well is difficult. And I think the fact that the HSE has added over 7,000 additional staff, mainly clinical staff this year, is an achievement, one that we should recognise. And they have the authority now to continue that recruitment and take more staff on. Yes, we didn't add the 1,100 beds that we aimed for, but we did add 850. That's the equivalent of 2 hospitals. That's quite an achievement in the space of less than 2 years, and we need to continue with that now, because although trolleys are still too high today, they're not far off half what they were 2 years ago, and we need to keep expanding our health service to bring those numbers down further.